What's up, guys? I received a few messages from you guys asking to do some teaching on EKG grids. Actually, basics on basic EKGs and how to read EKGs and how to calculate heart rate. How do we calculate QT interval? How do we calculate PR interval? How do we look for the QRS? How do we know it's wide? How do we know it's narrow? So in order to do those things, we need to learn about the EKG grids. What I mean about that is we need to look at this. Let's jump into it. So you need to know about this EKG grid. So if you don't know about this grid, then it's time for you to sit down and relax and watch the video and learn about it. If you ask many of the nurses who's working right now, who already have their license and working on the surgical floor, medical floor, you ask them about EKG, they might not remember about the grids. They might not be able to tell you about the QT. They might not be able to calculate it. But if you work in critical care settings like ICU, Emerge, so you will be you need to know those things, and actually we expect you to know and to be writing those intervals and everything into your chartings. Sometimes depend on the institution you're working at, but I know in ICU for sure you need to do that. In the Emerge I was working with, we used to write it, so you guys should know those things. So if you're planning to work in ICU and Emerge in the future, you should know this. For the future, you need to remember it, and for your exam you need to know this for the NCLEX exam. So make sure you know this basic, at least this basic knowledge. It will help you to calculate your heart rate. So if you did UWorld, like I said before, they will actually say to you, click on the exhibit. So when you click on the exhibit, they will not give you the heart rate. They're just going to give you a strip, and it's up to you to calculate the heart rate. It's up to you to figure out, is this a sinus tach? Is it an SVT? How the hell are you going to know if you're not able to calculate the heart rate? So, but we just look at this EKG grid and we'll figure it out. Okay. So how do I know if this is a 6-second EKG strip? So 6 seconds, you can see here this big square is like 0.2 seconds. So 0.2 seconds multiplied by 30 squares, that will give you what? Your 6 second. Just a little bit of math. Okay, so this is how I know this is a 6-second EKG strip. So in the exam, I know in UWorld it will not give it to you, but some institution where you work with, they have a little bit of marker on top of your EKG here, which make your life so much easier. But I guess in the exam they won't make your life easier, but you need to know those things. So, but in real life, 15 squares will gonna give you 3 seconds, and this another 15 squares, it's gonna give you another 3 seconds. So 3 and 3 will give you 6 seconds. So the whole strip is going to be 6 seconds EKG strip. So you always look at a 6-second EKG strip in order to calculate heart rate. So we'll get to that in another video, but we just want to do the basic part right now. So you look at the gridding system. All right. So I hope this is clear. So you look at this. You need to know this. This is a basic EKG when you read it. Now look at the bottom part here. Actually, this is an extrapolations of your the EKG, and so you can see, there we go. So this one big square we were talking about earlier, the 0.2 seconds. If you extrapolate it, so it will give you 5 smaller square. So 1, 2, 3, 4, 5. and each of those small squares is actually 0.04 seconds. So basically it's 0.2 seconds divided by 5. We're going to give you 0.04 seconds. Okay, so all you need to know is one big square, which I usually call it the big square, which is the 0.2 seconds, and then the small square is at 0.04 seconds. And you need to know this in order to calculate your PR interval. You need to know this to calculate your QRS. You need to know this to calculate your QT interval. So why do we need to calculate these things? So we have a drug that will cause QT prolongations. Let's say somebody that come to you emerge who is very violent, who has psychosis, is going to try to punch you or whatnot, and the physician will say, well, give this person like 5 and 2, so basically 10 and 2, so or 5 milligrams of Haldol and 2 milligrams of Ativan IM, and that actually will cause chemical sedations to them. So if you go ahead and give it to them, and you don't know the EKGs, there was no previous EKGs, anything like that on chart, and that causes the QT prolongations, and that can cause, and we already have a QT prolongation, and if you give Haldol, that will cause an even longer QT prolongations, so you end up can kill this person. So this is why it's important. This is why I said to you in the previous video, the reason why you're writing the NCLEX is we want to make sure you're safe to practice. You know the basics. You'll know when something's going to go wrong. You know when to report it to the physicians or to your colleagues and looking for help. So this is the exactly reason why you need to know those basic grids about EKGs. I hope that made sense. If you have any more questions, you can post it down in your comments. If you like the content, put a thumbs up, subscribe to the video. Until then, we'll talk to you next time. Take care, guys.